Here at Westside-Medical. Today we're going to talk about how to roll out your hips. When I say hips, I'm talking about your gluteus medius and minimus muscles here, your piriformis, as well as your glute muscle. Now these muscles are really sensitive to repetitive stresses. If you're at a job where you stand all day, you get some adhesions, it's going to get tight through here, it's going to compress this femur head, cause some hip pain. A lot of athletes that do a lot of squatting, deadlifts, can get a lot of adhesions in the glutes or the piriformis, and that's going to affect their performance. So first we're going to talk about working the gluteus medius and minimus. It's pretty much your side hip muscles here. So you're going to take your lacrosse ball, and you're going to lay on the floor and you're going to do a couple motions. You're going to do cross work like this. So you're going to go right perpendicular to the muscle, you're going to roll it across there, and then you're going to compress and traction the muscle. So you're going to compress the muscle, so you're laying on the floor, compress that muscle, and you'll lift this leg like this. So you compress it and stretch that muscle, and that's going to pull apart those adhesions that's causing that tension and the pain. The next one, we're going to do the glute muscle, and it's this big muscle back here that lays on top of the piriformis. So you're going to kind of roll first, do some cross friction, and then the action to stretch that muscle is you're going to just find the tender spot, compress, and you're going to lift that knee up, and that's going to traction that muscle through its range of motion, pulling apart the adhesions. And the next is the piriformis muscle, which runs from the sacrum right to the femur head here. And so you're going to do cross friction, and then when you compress it, you're going to lift your leg up, and then you're going to bring your foot up towards you, and that's the motion that stretches the piriformis. So you can compress, lift the leg up towards you. Good. So let me demonstrate how you actually do it. So take the lacrosse ball on the floor. You're going to find the head of your femur right here. Go up from a little bit. And you start with cross friction, back and forth like that. Now we're going to compress and traction. So you compress the tender spot, and lift your foot up off the floor like that. Compress, tender spot. Good. Now for the glute, hips up. Do some cross friction, kind of just roll out that muscle. And then you're going to compress it, and you're going to bring that knee up like this. So you can compress up like this. Make sure you get up near the belt line. That's where the glute inserts. You're going to find a lot of adhesions there. So you can compress, lift it up. Next, the piriformis. It's deep to that glute muscle. So to bring that out and do cross friction on it, you're going to cross your leg over and just roll out that whole glute. That brings that piriformis muscle belly out from underneath that glute muscle. So you're going to roll it like that. The next one to do compress and traction it. So you find the tender spot, compress it with the lacrosse ball, and bring your leg up like this. And that's going to pull the muscle through its range of motion and work out those adhesions. Just like that. So if you find a tender spot, if you want to work on it, you can do this like 2-3 times a week. Do it after work, do it before a workout to warm up. So see if that helps. Visit us at westside-medical.com or like us on Facebook.